Hello, Chamero TV viewers, and welcome to Fireplace. My name is Godfrey Mutiga. Well, today on Fireplace, we want to speak about matters health. And who is better placed than Dr. Stanley Aruyaru? He calls himself the village surgeon. Well, we are about to find about that. But meanwhile, we want to know what happened in his life and why. At one point, his dad wanted him to be a mechanic. But as fate would have it, he became a human mechanic. Ladies and gentlemen, we are coming to you from the Stairs Hotel, and welcome. And thank you so much for subscribing to Chamero TV on Facebook and Chamero TV on YouTube. Dr. Stanley Aruyaru.
Yes, Godfrey.
Welcome to Fireplace.
Thank you very much. It's
Yes.
a pleasure to be here.
Good to see you.
Same here. How are you?
Hey, how is the medical profession taking you, Dr.
It's taking me well. You can see I'm not gaining weight, so
Yes.
that is good.
Yeah.
Yes.
Okay.
And I'm happy to share a little more about it
All
in
right.
this show.
All right.
Yes.
All right. For the sake of our viewers, maybe you would like to tell us who Dr. Aruyaru is,
Absolutely.
where you grew up, and how you found yourself to be a top surgeon in Meru County.
Absolutely. Good
Yes.
evening, viewers. It's a pleasure to have your audience. My name
Yes.
is Stanley Aruyaru. I'm a surgeon. By specialization, I'm a general and laparoscopic surgeon.
Yes.
I presently practice at St. Teresa Mission Hospital in Kerua,
Yes.
where I double up as the resident surgeon and the director of medical services.
Okay.
I have over 11 years of experience in the medical field, and I know we'll talk a little about that as the show goes on.
Yes.
And I hail from this county,
Yes.
Tigania
Meru.
East Sub-County,
Yes.
Lailoba, which is in Mudara Ward.
Yeah.
Yes, so I am born and bred, and now I practice in Meru.
Yeah.
Yes.
How was life growing up, Dr.
Life growing up had its ups and downs.
Yeah.
I actually do not exactly remember what transpired before I joined primary school, but I know I enjoyed primary school when the goats I was entrusted to herding were decimated
Yes.
by some livestock disease.
Yeah.
But I joined primary school at 9, which means I was quite late to
Yeah.
join primary school at 9 years. And then I went on. I can't say much. We didn't have much by way of material wealth. So we would struggle in some seasons. We would sleep hungry, and sometimes we would struggle to raise school fees.
Yes.
And I know all that. I was just joking to some people the other day that I wore shoes in really late days of my schooling. And as you've said in the intro, when I finished KCPE in Lailoba Primary School,
Yes.
I scored quite well. I had 501 out of 700 marks. And I had gotten a provincial admission, a provincial school admission.
Yes.
But my dad and my family didn't have much by way of money to take me to secondary school.
Okay.
So dad told me, you're going to the village Polytechnic to study to become a mechanic, because that is what he could afford.
Yes.
We say you cut your coat according to your cloth,
Yes.
your size notwithstanding. And I was prepared to go to Ndangarine, in Mudara, for my village Polytechnic,
Yes.
training as an artisan really in mechanics. I had even done some little shopping, and I had been taken to Moredi, which is a nearby shopping center,
Yes.
so that on Monday morning I could just trek to the
Yes.
village Polytechnic to
Yes.
report. And then my teachers and the parents from my locality got wind of what was happening, and they sent an emissary to come and stop me in my mischievous tracks and make sure that I did not proceed to the village Polytechnic.
Yes, yes.
So I was called back, and the teachers and the parents and the well-wishers came together and raised funds
Yeah.
so that I could proceed to secondary school.
Yes.
So that is how my secondary school dream was resuscitated when it was on the blink of being vanquished. I went to St. Cyprian High School. I remember I reported the day the rest of the students were coming from midterm.
Yes.
And at least for the first 1 year, the fee that had been raised through the Harambe was sufficient to get me through that.
Yes.
But after that, it was cat and mouse, struggle after struggle, trying to get some school fees to sustain me decently enough in school.
Yes.
I actually remember towards the end, the school balance was humongous. And at some point, the principal had to send us home to get some school fees before we could proceed. And unfortunately, this is the time when we had already started the agriculture project for KCSE. and you had to go get school fees.
Yes.
And anyone who remained must have had cleared their school fees or have little balance.
Yes.
Otherwise, they needed a school meal card so that they could remain in school.
Yes.
So I remember I would go home and sneak back on Friday night, come, copy the notes, everyone, and written throughout the week.
Yes.
Gather a few other textbooks, borrow a few other textbooks that I could carry away,
Yes.
go weed and tender to my agriculture plot and water it. And then on Sunday morning, I would jump through the fence and run away because I couldn't afford to be in school during the school, days. And eventually I got caught.
Yes.
Because on one Friday I came, and the next Saturday there was Science Congress, and I was representing the school.
Yes.
At the district level, and we proceeded there, and then our project won.
Yeah.
I was with Mutomboi as my co-presenter in the
Yes.
chemistry talk. And I was here in a catch-22. Do I go home on Monday morning, or do I wait for the assembly? Because now the trophies would be presented to the principal.
Yes.
And I opted to wait.
Yes.
When I waited, the trophies were presented. The principal looked at me and just gestured, "Recruit more people into your team."
Yes.
And I thought that was it. And once we got to class, the principal sent word that I should get to his office after the first major, which was a mathematics double.
Yes.
I went there and he asked me, "What are you doing here?" And I see your school fees is still in arrears.
Yes.
And I had to say I came for the Science Congress and I came to water my garden, and
Yes.
now I didn't know what to do when we came here.
Yes.
To cut the long story short, anyway, he sent for my parent, they had an altercation, they squeezed the little they could at least to register me for KCSE.
Yes.
And then throughout the remainder of Form 4, I got a lot of money by way of the Ministry of Education bursary that got me to at least finish school. By the time I cleared, I had humongous balance. But over time, the ministry was able to offset that through the bursary.
Yes.
And that is how I finished secondary school. So that essentially was my growing up. It wasn't the rosiest of upbringings.
Yes.
We have had our fair challenges. And in my family, actually, I'm the only one who has gotten to university to a degree level. Yes, so we are from a humble background.
Okay.
Yes.
But now, at that particular capacity, because now you're working and you're now a surgeon, are you
Yes.
able now to support even the others to become like the way you are right now?
I don't want to take on that responsibility and say I can support everyone to be the way I am,
Yes.
because there are several perspectives. You know, if you've not been admitted to a university to pursue a university degree, then I cannot support you to get a university degree because that is academic oriented.
All right.
Some of my siblings did not go to secondary school, and that is already past their age to go to secondary school. They have
Yes.
settled down and all that.
Yes.
But I support in the little way I can, where it is practical and where it is possible.
Yes.
And of course support my family and my parents as well.
Yes.
And we support each other as a family. That's all I can say.
All right.
Yes.
All right. Now, this is Fireplace, where we talk about stories that inspire. Most probably, you would like to tell us, how was the medical school, and how did you find yourself now to be a top surgeon in Meru?
Top surgeon
Yes.
is an interesting tagline, but I will take it in open arms.
Yeah.
When I finished Form 4,
Yes.
you know, you had to wait for nearly 3 months or so before the results could be out by February.
Yes.
When the results came out, I found my name on the newspapers, and I was certain if I am there, I must have passed.
Okay.
So I had scored a straight A, and I had applied to join medicine because medicine was, you know, it is still the prestigious course. Every Form 4 leaver, every Class 8 leaver says, I want to be a doctor, I want to be a surgeon. So it wasn't any different from us. And for me, even right from the beginning, when my father went to pick the admission letter from my primary school, my former senior teacher, Mrs. Baidambu, actually told him, do not deny us our first doctor. She was just speaking prophetically. That time I had just cleared Class 8. When we went to secondary school, every teacher would tell us, this institution has produced all manner of professionals except 2, medicine and law. And therefore, we were inclined to make sure that we make our teachers proud by occupying those 2 slots that are not being occupied.
Yes.
Being a science-oriented student, I wanted to join medicine.
Yes.
So I applied for medicine, the University of Nairobi as my first choice, Moi University as my second choice. When the admission letter came, it came from Moi University. So I was admitted to Moi University for medical training.
Yes.
how I can summarize medical training and the university experience per se, it is leveling and it is humbling.
Okay.
It is leveling in the sense that if you know your craft, if you read well and prepare well, you will pass exams.
Yes.
If you don't prepare well, no one recognizes that you are top of your district or you earned an A. Everyone in that class earned an A.
Okay.
In fact, in medical school, you sit in the library. If you happen to get the daily newspaper where your results appeared, and you look to your left, you look to your right, you can imagine you are doing a roll call on the daily newspaper, because the names on the newspaper are the names in the class rota, you know. So essentially that is how it is. So it was a shock to begin with for several reasons. The first being the competition. The level of competition is at a completely different
level,
yardstick. And secondly, the volume of work to consume. I know you've interviewed Bundi Karau on this seat, and he has shared with you the volume of work to consume when you're studying medicine within a short period of time. So that would take away time, where everyone was studying for 2 terms, would study for 3 semesters. So term 1, term 2, term 3, and between term 1 you finish exams, you maybe have a week to a week break, and you're back to the second term, and maybe the longest holiday you would get is less than a month over Christmas, and you're back. So it was strenuous, it was intense, and it was humbling. That is the much I can say about medicine when you start. When you start to qualify and practice, then it also gets satisfying if you're able to quickly save a patient's life. Sometimes when systemic challenges come in and frustrate you, it can still be a perpetually frustrating journey. So I trained for 6 years in Moi University from January 2005 to the December of 2010. I graduated. I couldn't ferry my team to Eldoret, so I ferried my gown to the village, and then we had a small, and then we had a small ceremony.
Celebrations there.
Yeah, so we had a small ceremony in Lailoba, just a mass really to celebrate and pray and thank God and all that. Then I returned the gown, and then I hit the ground running. I was an intern in Consolata Hospital Nyeri. For a year. That was 2011, the whole of 2011 to the first 2 months of 2012. Then from 2012, another month elapsed before the ministry could post us. So by April, when we got the posting order, I was posted to Transmara district, current Narok County, in a hospital called Kilgoris. I reported there beginning of June. We did quite some work. We started some theater that was almost opening. We opened that up. But I was intent on quickly getting back to specialist training so that I could now practice as a specialist, not as a general practitioner. And surgery was my passion all through. So I interviewed for the Aga Khan training program and passed the interviews. And I had to tender my resignation to the government in November of 2012, so that in January of 2013, I could start my surgical training. So I trained as a surgeon in the Aga Khan University Hospital, the East African Medical College, which is headquartered in the Aga Khan Main Hospital in Nairobi. That was 2013, 2014, 2015, 2016. And I graduated in early 2017 when I just started my practice as a surgeon now. Again in Nyeri, I practiced there for 3.5 years, so to speak. And then I found myself in Meru. And I've been in Kerua now for 2 years and counting.
All right.
Yes.
Dr. I would like us to quickly talk about the state of health in Meru County. Now, from that perspective of being a surgeon, what is your comment on the state of health in Meru, and most probably in Kenya?
Absolutely. So I will start in Kenya and then, zoom in on Meru. In Kenya, the state is that we need more. Once I have that opening bracket, I can always break it down into small things. We need more infrastructure. We need more human resource. We need more manufacturing. We need more in terms of system efficiency. So health sector per se in the entire country requires a lot. Requires a lot in terms of human resource, in terms of infrastructure, in terms of capacity building, all that. Granted, with the devolution, a little confusion came along the way, so we left a lot of the human resource and infrastructure to the devolved system, and then the policy to the national level, and of course the national referral hospitals to the national level.
Yes.
My stand, which is on peer-reviewed publications and great literature and media over, is that my stand and the stand of so many of our colleagues is that the human resources for health, talking about doctors, nurses, clinical officers, nutritionists, name them, should have remained under a central body. That way we could distribute resources equally across the country in terms of human resource, and then we can do the others from the county level. But we devolved that, and there was a little confusion here and there.
Yes.
And with pockets of competing interests between health and other sectors, then you realize that health does not get the punching weight it desires.
Yes.
Health is a service. When health is a service, it is not romantic and enticing. We are in an electoral period, for instance.
Yes.
Every elected official who is campaigning now would want to show a huge building they have set up. But that might not be tangible if they are telling you, we streamlined the hiring of health officers or doctors, or we promoted so many doctors, or the efficiency or the turnaround of patients in this hospital moved from this number of hours to this number of hours, because it's not tangible and might not be sensational to the public. So that becomes where the health sector is hit, consistently hit. Now let me address myself to the human resources for surgical workforce. Recently we spoke, I published an article with my colleague Dr. Mwachiro, where we said out of the district hospital, you know, the old district hospitals, which are now level 4 hospitals, only 2 out of every 10 level 4 hospitals have a surgeon. This is a Ministry of Health sanctioned study that found that. And when we look at Kenya as a population, we have a global assessment that says for every 100,000 people, you need 20 surgeons. Guess how many we have as a country?
How many do you have?
2.3 per 100,000 population, which means there is need to train. So I did not want to zero in on the county, because this is true in Meru County, this is true in Laikipia, this is true in Tharaka Nithi. It can be replicated in every county. As a country, we are suffering shortage of human resources, trained, equipped human resources. This is the first priority. Now the second priority, which now as I want to address, I want to come home, is the purchasing power. The purchasing power of health. By way of health insurance. This is what our people have as a problem at the moment. Majority of them, if you look around, maybe 90 to 95% will be funded by the national insurer. If you look at how much the national insurer is funding, the insurance model is premised on a working public system, where there is nothing to cater for salaries for health workers. What is given is probably for consumables or something like that. But if you still have to look at that package for private hospitals or faith-based hospitals that still have to use whatever they generate to run their payroll and their human resource, you see that funding needs a little injection. This is from the provider side of view. From the consumer side of view, we still have a critical mass of Kenyans who do not have insurance. And some of them, if you have an accident today, you are stuck in the hospital, you don't have insurance. How do you get a life-saving surgery? How do you get the medication you need? How do you get to clear your bills and get back to your productive
What do you think is the
activity?
solution to that?
Now the solution is multiple-pronged. I have worked in the private sector more than I have worked in the public sector. But I've always said the public sector cannot abdicate the responsibility of health. The private sector only exists to support the public sector. So if the public sector quickly comes up at par and provides all the services, and all the sub-district, sub-county hospitals are funded, resourced, equipped, and staffed, you see that kind of gives more breathing space to the faith-based and the private hospitals which are supporting. First bit. The second bit is to find a way to offer insurance to as many Kenyans as possible. If Kenyans are not insured, however, even you and I, if we don't have insurance and we are hit by an emergency, we will find ourselves spending our food budget on healthcare, which is wrong. So two ways to say is to train, equip, staff, facilities. I am talking about the public, because the private is usually a business model. The public is where the government has a social contract theory with
Yes.
a social contract with the electorate. If that is done, we will solve a lot of the problem. The second bit is if we can ensure Kenyans have an insurance.
Okay.
Whichever way, those who are not able, let them get a social protection.
Yeah.
Those who are able, let them have insurance. That way we will address majority of the problems we
Yes.
have. We won't conquer all of them,
Yeah.
but we'll have addressed majority of them.
Yeah.
Yes.
Yeah, Dr. Ari, they say a healthy society is a society that is able to work and be able to deliver. Now, we have seen the mushrooming of private hospitals in Meru County, especially. What is your comment on this? Are we saying that Meru, the Meru people are suffering and maybe the state of health is poor or something? What are we saying?
Everyone has got their own perspective, and if I have to address that, perhaps
Yes.
I will address it as a lay person, not as an expert in economy or business,
Yes.
or something like that. But one thing I will think is the business drivers who are driving the private hospitals have seen an opportunity. They have seen a market.
Okay.
Now that market can be on several fronts. It can be on the population vis-a-vis the hospital coverage, that is one.
Okay.
Number two, it can be on the efficiency of the existing facilities, so someone wants to come and plug a gap. And these are theories I'm floating there.
Yeah.
It can be on the purchasing power,
Okay.
because there is also that perspective that Meru as a people do not have a problem with purchasing healthcare.
Okay.
So if you go there, they don't have a problem with purchasing, because there is somewhere else you might set a facility and no one is willing to pay
Yeah.
premium.
Yeah,
They
sure.
just want to go to the district hospital, for instance. So there are all those permutations, and everyone has got their own model on what they are chasing and what they are chasing. For me, I think Kenya is a capitalist society, so
Okay.
it's free business as long as it's regulated according to the authorities that be, and it meets the regulation and the ethics of practice.
Yeah.
If you are selling something that is above your competitors,
Yes.
you will have clients.
Yes.
If you are selling something that is the same as your competitors, then you have to differentiate it in a way that people will troop to you.
Yes.
If you are selling it at the same level as your competitors and all of you have clients, well and good, it means the market is not saturated.
Okay.
So I see it as a good opportunity, and also
Yes.
as an opportunity to give our clients or the patients, second, third, fourth opinion.
Okay.
When they don't agree with Aruyaru, they can go to Godfrey.
Yes.
They don't agree to Godfrey, they can go to another person,
Yes.
and they are all within reach. They don't have to travel to Nairobi.
Okay.
Yes.
A quick one on the issue of cancer. We have seen the menace that cancer is causing in our society, and especially Meru County. What do you think is the lasting solution to this, Dr. Ari?
Lasting solution to cancer, if anyone under lasting solution, it will be a groundbreaking Nobel Prize kind of invention where you know what causes the cancer and you give people vaccines about cancer. That would be the ideal.
Yes.
We don't have that because we don't know what causes cancer. Only a few cancers are known, this is the cause. Otherwise, what we say is there are several risk factors or several things that can play to make someone develop cancer.
Yes.
But let me come to the burden of cancer. What
Yeah.
you've observed is correct.
Yes.
It's not just in Meru. It is in various other facilities, in various other counties and corners of the country,
Yes.
and actually maybe even in the region. Now what happens is, if we discuss it and start giving opinion, we might advance an opinion that applies in one region and is different from the other. And the opinion is usually on two ways. One, either the real prevalence of cancer is rising, or people are going to hospital more and being discovered, instead of being told, oh, he was bewitched and he was found dead, it is found he had cancer. So you see, that is the narrative.
Yeah.
The point, irrespective of which narrative to push,
Yes.
the point is
Yeah.
what determines conquer over cancer for any society, be it in Meru, be
Yes.
it in Nairobi, be it in America, be it in the UK, is at what point the cancer is discovered.
Okay.
If it is discovered in what we call stage 1 and stage 2, it is easy to cure.
Okay.
If you are getting it in stage 3, it's difficult.
Okay.
You will try, but the success rate will be low. If you're finding it in stage 4, it is incurable.
Are you suggesting that people should get screened more?
Absolutely. Now the thing is, people should get screened for cancer.
Yeah.
Now you can tell everyone walk through the supermarket and get a screening.
Yes.
We look at people who have met the screening criteria. For instance, if you are if you have family history of a certain cancer, say if you have a family history of breast cancer,
Yes.
then we know when you get 40, start getting screened.
Okay.
If you have family history of this other cancer, when you visit your doctor, tell them, my father had this cancer.
Yes.
They will give you a specific direction on get screening for cancer. What is screening for cancer is a list of tests and physical examination by the doctor that can be done every year or every twice a year.
Yes.
Now that might be music to the ears of people who are struggling to make ends meet. But the one thing that every single day I struggle with and I feel frustrated about is when someone has labored with pain, discomfort for months to years, and then they come and they are discovered to have advanced cancer.
Okay.
Why? Because they went over the counter and they said, I feel I have some heartburn, and they are told take yogurt or take maziwa mala or take this tablet. So my call would be if someone has some discomfort, because your body is supposed to be normal, but the moment you're feeling I'm not myself, I am weak, I can't walk, I'm feeling uncomfortable, get a doctor's opinion. And if the doctor treats you and within a week that is not going, get another opinion, because I also have so many patients who come after months and months and months of being treated for gastritis, acidity, indigestion, H. pylori. You must have heard these terms, they are very popular. H. pylori, on one place they are called H. pyloria. H. pylori is the true word. My very people, H. pylori is the word, not pyloria. So they have been treated all over, and they never got to maybe a specialist to see them and tell them, no, it's not H. pylori, come get this special test, we will find out. So you discover cancer because someone has been treated for malaria, amoeba, because the expertise they were seeing was not equal to the task of determining that if I have given this treatment and it's not worked, let me refer. So it is now a sensitization for everyone. If you feel you are unwell and you've received some treatment and you're not getting better, get to a level where you can see a doctor, you can see a consultant, you can seek a second opinion. Don't just sit and say, hey, the doctor said I can take this tablet and I should be okay. I'm not okay, that's my problem. Yes.
All right. Now, Dr. just want you to do the parting shot now.
Yes.
And even as you tell us whether you still want to continue your passion of writing books.
Yes.
And a quick one, tell the people of Meru, Kenyans, your parting shot on matters health, and as we wind up the program.
Absolutely, absolutely, absolutely. Health, your health is your wealth. Your health is your wealth. If there is anything we have learned from COVID, it is health is the most important resource you can have. So please, if you don't have insurance, get insurance for your health. If you feel unwell, seek medical advice. And again, as we learned from COVID-19, not everything from outside is superior. You know, COVID came from outside, then we locked the borders, and we remained here and we survived. So sometimes you don't have to fly out. We have those interventions here. In terms of writing, yes, I write. My first book is The Chronicles of a Village Surgeon. My second book, I am somewhere along the way. I'm hopefully in a year or less, I will be done with that and I will be announcing the title. And you are welcome to purchase it on Nuria Books or Rafu Books or Amazon. And you can follow me, Dr. Stanley Aruyaru, on Facebook, on Twitter, on Instagram, and my YouTube channel. All right. Yes. That's good. And it's been a pleasure. Godfrey, thank you for having me. Asante sana. Asante sana, Daktari. Yes. It's been a pleasure having you. Yes. And I hope you are not, going to see another serious wave of COVID, because I understand the minister, the CS in charge of, health has said people should start wearing masks. What do you think? We will say that we will go with the advisory from the ministry. Yes. When it is a global public health issue, it is good to not split hairs and divide opinion, but follow the direction that comes from up. All right. But our hope is with the vaccine, all these masks and social distancing and all that, we were doing them hoping and waiting to get the vaccine. All right. So really now what Kenyans can do is get more and more booster shots. If you are called to get the booster shot, get your vaccine. If not been vaccinated, get vaccinated. Vaccines save lives. All right. Yes. Asante Aruyaru. Thank you so much. Thank you for coming to Fireplace. Absolutely. Thank you so much for having me. I enjoyed myself. We wish you all the best in your endeavors to be the best that you can be. Asante sana. Asante. All the best with the show. All right. Thank you so much. Chamero TV viewers, that has been Fireplace, been hosting Daktari Stanley Aruyaru. He has been here to inspire us all about his personal life
and also the state of health in Kenya and also in Meru. Thank you so much for subscribing to our channel at Chamero TV on Facebook and also Chamero TV on YouTube. We have been coming to you from the Three Stairs Hotel, one of the best hotels we have currently in Meru County. Just come here and get served with the best of their hospitality. I've been your host, Godfrey Mutiga. See you next on Fireplace. Thank you.